Dr. Adewunmi Alabi, a consultant, radiation and clinical oncologist, NSIA-LUTH Cancer Centre in Lagos. Thank you so much, Dr. Alabi, for joining us.
Thank you very much for having me.
It's my pleasure. Now, the 4th of February every year, we already know that is World Cancer Day. And the theme for this year is Together We Challenge Those in Power. How do you think that this theme reflects the global demand for the prevention and the care and the diagnosis of cancer?
Thank you, Blessing. So just like you have said, we're looking at efforts to close the cancer care gap. And over the years, we've looked at different models of which or how we can actually close this gap. And so this year, we have decided to take it to another level and involve the level of the government for as many stakeholders we have in the cancer space. These are people who have a say into how cancer care should be run in every country. And so because of that, we have decided that we have done so much of awareness, we've done so much of advocacy, but this time around, we want to look at how we can engage our stakeholders, our leaders, to see how we can make this care accessible, available, affordable to everyone. You mentioned something about ensuring inequality, tackling inequality, inequities, and making sure that there's fairness at every level. Fairness, because cancer can affect a child, can affect an adult, it can affect even the elderly. And so if you can affect any of these age groups, we have to put things in place that will be able to address each of these age groups and to see how we can make sure that they have access to treatments, to cancer medications. If we look at the challenges we're having now, so many of the big drug companies are folding up and leaving the country. Cancer drugs are becoming more expensive. And so all these things are things that we cannot tackle at the hospital level, but we have to take it from high up with our leaders to make sure that we have all these things available and accessible to our patients.
Right. And what specific actions, Dr. Alabi, are being called for, especially from world leaders, to achieve a just and cancer-free world? Because it's one thing to talk about the need to unite and, fight cancer, but it's another thing to have specific action plans that can, feasible action plans that can help us have that cancer-free world that we yearn for.
Yeah. So part of the efforts that is in place right now, as we speak right now, we have our cancer organization, our national cancer body, that's NICRAT, the Nigerian Institute for Cancer Research and Treatment, that was inaugurated last year by the presidency. And they actually have a meeting this week, which is part of the efforts that we are putting in place as a country. And in this meeting, stakeholders, the ministers for health are all present to dialogue on ways in which we can make cancer treatments available and affordable to our citizens. I also mentioned that part of the effort the government is making right now is to make sure that in each geopolitical zones that we have radiotherapy machines. This is one of the machines that is used for treatment of cancer patients, to make sure that we don't only have it in the big states, and we have it in states that people can access and also make themselves available for treatment. In another sector that we're also looking at has to do with ensuring that the National Health Insurance Plan covers cancer care. Many of the drugs now are actually on NHIS, the health insurance scheme, and patients can access this drug at a cheaper rate than they would get if they had to access it without being on the health insurance scheme. So we're encouraging Nigerians to join the insurance, to register with the Nigerian Health Insurance Scheme, so that they can have access to these drugs. The government has also put some initiatives in place, which has to do with making sure that some tertiary hospitals, government-owned facilities also have this access program where patients can get their drugs for 30% of the cost or 60% of the cost, depending on how expensive the cost is. And so all these things are some of the things that are actually on ground now. which we're even making efforts to see that can they get their treatment free? Because in the Western world, this is what they enjoy. They enjoy the privileges of having their treatment free. They enjoy the privileges of joining clinical trials that will be able to put the patient on that platform where they can have access to their treatment without them paying out of pocket. Because when we're talking about cancer death now, death will come when the patient cannot afford treatment, cannot get the necessary care, and then eventually the patient will die. So our mortality rates will increase. So, but when we're beginning to have things in place that can make treatments accessible, affordable, available to patients, then we can be sure that we will have more survival outcomes from our patients.
Right. Let's take a look at Nigeria's healthcare facilities. I know that it's World Cancer Day, and we can also use Africa as a case study, but let's narrow it down to Nigeria. Do you think that as a country, we're fully equipped in the fight against cancer? Talking about the facilities and the resources at our disposal now.
I won't say we are fully equipped. We still have a long way to go. For a population of roughly about 200 million population, and we have very few functioning cancer centers in the country. We are not near what the statistics says that we should have in terms of how many millions of people should be entitled to have a radiotherapy facility or access to. So we are not anywhere near it. We keep pushing for government to make these things available. And part of what we in Lagos enjoy is that a public-private partnership, like where I work, the NSIA-LUTH Cancer Centre came up. If the government can actually help to fund so many of these radiotherapy facilities or cancer centers, not just radiotherapy now, so many of these cancer centers will be able to make treatment available and affordable to our people. There are so many places within the country that do not even have specialists, do not have oncologists who can manage cancer. So we are left with the surgeons doing their little bits that they can do, because do you have to send every patient to Lagos to get an oncologist? So in terms of even personnel, we are deficient in that. Not to now talk of when we talk about the Japa syndrome, where a lot of doctors are leaving again. So we're having a lot of issues when it comes to personnel as well. And I want to believe that the government is looking into that to make sure that we have more people stay back to actually help to cater for our patients. So in terms of infrastructure, we are not there. We are privileged now to say that we have quite a lot of the cancer medications available in Nigeria. Now, the issue with cancer medications is no longer availability of it. We can have virtually any drug we want to use, but can the patients afford it? When you look at the exchange rate by which the drugs will come into the country, how many people can actually afford these drugs? And so these are some of the bottlenecks that we have, which I believe that if we keep engaging our government, if we keep engaging our leaders, we keep engaging our NGOs, our non-governmental organizations, we may be able to actually get to that level where we'll be able to get all these drugs at affordable prices for our cancer patients.
Now, looking at how far we've come as a country, as a continent, and globally, what progress would you say has been made in cancer prevention and care? And where are the gaps or the lapses that we still need to fill to address the issues that we have?
Okay, so I'll start by saying that a lot has been done in terms of awareness and advocacy. So much has been done, so much still ongoing, so much more to do. I think we have reached a point where, as an oncologist, I can confidently say that awareness, advocacy is not as bad as we used to have it. I would not say we're there yet, but it's not as bad as we used to have it then. So people are becoming more knowledgeable about what it means in terms of screening, in terms of prevention. People are becoming more knowledgeable. We will still continue to push efforts, and thankfully we have people like you who are making these things possible for us to pass the message across to our social media platforms and every other platform that we can get. So we are getting there when it comes to awareness and advocacy. So now we also have the issue of dispelling myths, okay? Myths and misconceptions about cancer. If we're also able to tackle that, because that still has to do with also awareness, creating health education and making people aware that they need to get over with these myths and misconceptions of what they believe cancer is, not seeing it as a spiritual attack or seeing it as something that they can use herbal medications and then it goes away, just like you treat malaria and then it goes away. And so these are some of the bottlenecks that we're having, okay? The bottlenecks now that we need the government to face to help us attend to is like, in the Western world, when it's somebody's birthday, when it's a woman's birthday, the government is aware that, oh, this person's birthday is going to be on the 4th of February. And so annually, there are some recommended screening tests that the person is supposed to have. So she gets a message, and this is from the government saying, visit your doctor, you have scheduled for an appointment a day after your birthday, you are required to do all the screening tests. So that woman sees it as something that is in place already and that needs to be done. And so she has to do the test. And when those tests are done, if there's any red flag or any intervention that needs to be done, then they take that into consideration and get the woman sorted out or treated. In places like Egypt, our colleagues in Egypt hardly see patients with cervical cancer. And that's because they do a lot of prevention strategies, they do immunization, give vaccination to their children. And so they have put so many things in place to keep all this in check. And I think that those are the places where we need to engage our government to make sure that we have things in place, that we also ensure that we get screening done. Some people want to get screened, they do not know where to go. Some people want to get screened, they have no means of paying for the screening tests. Screening tests have gone high. And so because of that, so these are just some of the bottlenecks that we believe that if the government can come in and put some of these things in place for civil servants to get screening as at when due, and if we have all these things in place, we'll be able to reduce the burden of cancer. We'll also be able to reduce the burden of high death rates that we are experiencing now.
All right, Dr. Alabi, talking about today being a World Cancer Day, what are the key messages that you hope that people can pass across or people can get, as the case may be, in terms of spreading awareness about cancer and what the things that need to be done, to mitigate the effect of cancer, reduce cancer mortality in our community and in the world at large?
Okay, so the cancer is not a death sentence. We must keep preaching that cancer is not a death sentence. Unlike in the far past, we have quite a lot of survivors now. We have a lot of survivors because people are now becoming aware and they are presenting early. So if you know you have a challenge, you have a complaint that you don't understand, visit your healthcare professionals. People should learn to visit the right specialists, go to the right place. Don't have a breast lump and go to a roadside clinic and say you want to have it removed. Make sure that you get 1 or 2 opinions from people who are knowledgeable about these things. So we start with health education. We must educate ourselves. We must keep educating ourselves to make sure that we get this thing out of us. And then we talk about lifestyle modifications. We must improve on our lifestyle. We must reduce our stress indices. We must eat healthy. We must live healthy lives, because these are some of the things that will help us. And then we must know about screening. What are those things as a woman? At what age am I expected to do this screening? At what age am I expected to do this? What are the signs I'm expected to see if I have cancer? What are the things I need to look out for? And then for men too, so the same thing goes for men. The specific age, at the age of 40 and above, we expect them to do PSA screening. And then we're not talking about vaccinations, cervical cancer vaccination. Okay, so we're also encouraging women who have teenagers, who have children, who are at the age where they should get vaccinated, to also get vaccinated. So when we put all these things in place, we will be able to reduce the scourge of cancer in our environment, so that the death rates and the incidence rates of cancer will not be as high as the WHO is proposing for us.
Okay. There's also another issue at hand when it comes to stigmatization. And you have mentioned that cancer is not a death sentence. I think the question is going to be, how can especially workplace environment and policies of workplace support employees affected by cancer? Because we've seen a lot of things, especially on social media. Recently, I saw a post where a lady claimed that she got fired from her job because she found out, in her words, that she was dying. So sometimes people tend to feel like the workplace is too harsh, on people like this. Now, I'm not talking about supporting financially, even if finance is not involved, but how can workplace policies and the environment be more lenient towards people like that?
We can only keep advocating and talk more about it. Stigma is always a thing with, it's also related to culture. It's usually more with our culture here. And just like I said, that cancer is not a death sentence, neither is it contagious or infectious, so we should give good support to people who are living with cancer. This is not the time to abandon them. This is the time to give them all the support they need. When they get this good support, many of them do well. Many of them survive it. So in terms of financial support, in terms of psychosocial support, encouraging them and being there for them. So we shouldn't see them as people who we should ostracize from the environment, or we hear stories of, oh, the husband left when he heard that the lady had cancer and all sorts. So we want to advocate that let's identify the people who have cancer around us and let's encourage them, let's support them. And this will help them to also come out to say they are suffering from cancer, because many of them will not talk, many of them will not want anybody to know. They want everything to be secretive because they feel if people know, they will run away from them, or they will not be able to, they will not get help. And so we need to keep advocating and speaking, saying it out and letting people know that if you have or identify anyone who you think or you hear of someone who has cancer, go out of your way to want to support. When they get treated and they get adequate treatment as and when they need it, they would do well. Their response to treatment will be fantastic. They will survive it. So let's see how we can help those in our environment or those around us.
Okay, that's a good note to end it. Consultant Radiation and Clinical Oncologist, NSIA-LUTH Cancer Centre in Lagos, Dr. Adewunmi Alabi. Thank you so much. You really had a lot of profound words to say, and I really do hope that people are brought into this awareness. Like you said, cancer is not a death sentence, and we need to stop treating people as such. That's the least we can do as a society. And of course, in terms of the government and globally, there's so many other measures that can be taken and that should be taken to create a cancer-free society and a cancer-free world eventually. Thank you so much once again, Dr. Alabi, for joining us.
Thank you for having me. Thank you very much.
My pleasure.
Thank you.
Well, this is where we call it a wrap on VSA. Thank you so much for watching. We have discussed very salient issues from Nigerian women being sent in as prostitutes to Belgium and, of course, a World Cancer Day. And we really do hope that a solution is in sight for both critical matters that we have discussed. Do also join us in our subsequent episodes as we tackle issues as they pertain to the African continent. Not just the African continent, but also the world at large. This has been VSA. Thank you so much for watching. Stay with us. I'm Blessings Wasugu.